So we just put this information in the refractor. We got that from the, excuse me, the refractor. We just got it from the auto refractor. So first off, refractor. We're gonna wipe this off with an alcohol wipe. I'm gonna wipe just the white part here on top, and then also just around the lenses, but not on the lenses, importantly. You don't want that to touch the lenses. And then I'll grab a tissue. I'll wipe it off one more time, just so the patient isn't smelling a bunch of alcohol vapors, because that's not pleasant. So then I'm gonna make sure that both eyes are open, which they are. I can tell that because it says O with the line under both. I'm gonna unlock the machine and position it with both eyes open in front of the patient. I'll have the patient look through there. And I'll say, can you see that line there? And I'll usually have the line that we started with. If they're seeing 20/20, I'll have 20/30 on the board. So awesome. Can you see that line?
Mm-hmm.
All right. Can you read it for me?
FCBDE.
Great. So yes, if they need to position or change anything like that, typically they need to be tilted a little bit since the screens are on the right. So I'll let them know I'm going to close the left eye. I do that by turning this knob here. And then I'm going to start with the right eye. I'm going to swing around to this side. I'm in a remote. So first off, what I'm going to do, since she is -1, I'm always going to go up first toward the positive and then down to the negative. So I'm going to say with the right eye, I'm going to have her read one line down. Read that line for me.
OFLCT.
Is it better 1 or 2? I went up 0.25.
2.
All right, and is it better 1 going down or 2?
2.
And so she likes her current prescription. We're done with sphere. Then I'm going to bring the Jackson cross over. I'm going to make sure that it clicks into where the arrow right there is in between the red and white dot. I'm not sure if you can see that, but and since you've entered in her current prescription, I'm going to ask, is it better 1 or 2?
1.
So 1's clearly better. She's very confident in that. So we're going to move it towards the red, which is counterclockwise right now. So she's currently at, looks like about 146. So I'm going to move it just about 10 up. So I'm going to, or 10 up. So about 156, which is about here. Now I'll ask her, is it better 1 or 2? Or about the same?
2.
So 2 is much better. And she wants to go, let's see. Yep, so she wants to go back the other way. So what I'm going to do is I'm going to put it at just about 151. I'll ask her one more time. Is it better 1 or 2? You could also just stop. And
1.
So it's better 1. So she wants to go down a little more. Or excuse me, back up a little more. So now I'm at about 148 in between where she started and 150. Is it better 1 or 2?
2.
2 is better. And I'm going to leave it there. I'm going to leave it at 150 because she's kind of straddling around that area. I don't want to spend too much time on it. So now I'm going to switch it so that it clicks and aligned with one of the red or white dots. And I'll ask her, is it better 1 or 2?
2.
So that's aligned with the white dot. That means that she wants less cylinder. She's at 0.50, so we'll go down to 0.25. Better 1 or 2?
2.
And so she now likes more cylinder. So when you get something like that, you'll take the Jackson cross away and you're just going to ask them without the Jackson cross, is it better 1 or 2 between the two that they were between? So she likes her 0.50 that she was already at. Now, one last step, we're just going to recheck this sphere. So once again, I'll go up 0.25, better 1 or 2?
1.
So she likes 1. And 1 or 2?
Do it again.
1, 2.
2.
So she likes that 0.25 less right now. So she wants to go a little more minus. In order to add more minus, the patient has to earn a line. So I'm going to have her read 25. She was seeing about, I don't know, it was like 20, 30. Really.
APEOT.
So she likes 0.25, and then I'm going to do 20/20.
TZVEC.
So she's reading 20/20, and I'm going to ask her one more time, is it better 1 or 2?
2.
So she likes that more. So we're done with the right eye now. So I'm going to close the right eye, open up the left eye. I'm going to put 20/30 back on the board. Read that line for me.
Ooh. DAOFT.
Okay. So now we're going to once again go up 1. So better 1 or 2?
Do it again.
1, 2.
1.
So she likes 1 where she was, and 1 or 2. Going down 0.25 now.
Do it again.
1, 2.
1.
So she likes where she was. Once again, we'll go back to the Jackson cross. Make sure that It is in between the dots, and is it better 1 or 2?
2.
So very confident, clear 2. We're gonna twist it towards the red. Gonna go once again about 10 the other way. So 1 or 2.
1.
She likes 1, which I believe is even further that way. Okay. 1 or 2.
1.
So she's continuing to like it further and further one direction. So we'll keep going one direction. 1 or 2.
1.
1. Fun. We'll keep going one direction. I'm just going now in increments of 15. 1 or 2.
1.
So autorefractor, maybe I didn't enter it right or something went horribly wrong, because typically patients are usually, we try to get them
Go
around
back.
their ashes. Go back a little bit.
A little bit more. Yeah, there.
Okay. 1 or 2.
1.
1.
Yep, leave it.
Just leave it where it is?
Mm-hmm.
I thought the point was that it had to be the same between the two.
Well, you don't want to mess with the axis too much. Like they were already seeing good with like glasses and stuff.
Mm-hmm.
But I mean, I can tell when I kept taking in more axis, then it started getting a little bit blurry. So
I think I may have forgotten to put in your axis, because
Oh.
the axis is actually here, reading on the
yeah, that's blurry.
1
Put it back to
or
where
2.
1.
1. Okay. That's where it was.
Yeah, that cleared up.
Okay. So now we'll switch, let it align. And is it better 1 or 2?
2.
So that aligns with white, so she wants a little less of the cylinder. 1 or 2?
2.
So now she wants a little bit more, so then we'll ask her without anything 1 or 2?
1.
So she likes a 0.5, and once again, 1 or 2?
We'll do it again.
1 or 2?
2.
1 or 2?
1.
So now she likes, once again, just 0.25 more minus on that side. So we're gonna test that vision. Read that line for me.
FCBDE.
And try this line.
ZAGKP.
So she's seeing 20/20 in that eye. And so if she was older, then we test her near vision now. Should I go ahead and do that?
Yeah.
Okay. So we're gonna open up both eyes, leave her current prescription in, and I'm gonna have her, because we want to know where we're starting from, I'm gonna have her read the smallest line that she can on here.
APEORFDZ.
Yep, so she's already seen 20/20. She doesn't need reading glasses. If a patient did and they were having trouble reading, then what you would do, depending on their age, because the older you get, the stronger readers you typically need, you can actually turn these outer knobs in, and that would add +3, and then you could use these to go down from there. So now I'm at 250, 225, 2, and then you can always go back like this. Then I would want to go back up 4, because that's where we started. So then once that's done, you can put this up and move the phoropter away from the patient.
Oh, and you need to glare me.
Oh, let's go ahead and do. Okay, so if the patient is seeing 20/25 or better with their refraction, but they have cataracts and they're interested in cataract surgery, then what we're gonna do is something called a glare test. So she'll twist it to the side in order to see that fully. So we started with 20/30 last time. For the glare test, usually it's a little harder to see, so I'm actually gonna start with 20/50. And I'm gonna once again close her left eye and leave her right eye open. And I'll let the patient know, I need your help for this one. Go ahead and hold on to this and put it in front of there so that you can still read that line. And can you read that line for me? All right. Can you read that line?
EG and DH.
Okay, and then I'm going to turn the light on, and we always do the full brightness up to 3. So I'll ask her to read that line one more time. We'll go up and do that one. Overhead lights. Oh,
DAOFT.
all right, then we'll go down
EG and DH.
and down.
FCBDE.
Keep going down.
OFLCT. APEOT. TZVEC.
So she's seen 20/20 with the glare test. So then I'll have her try and position it with the glare already on for this other eye. If she has trouble with that, then I'll turn the light off.
Which eye?
Oh, the left eye, let me open it up. And close the right one. And I'll kind of, I'll help
Thanks.
them. That's okay. Alright, and I'm gonna go ahead all the way back up to 50, but for her, because she was already seeing 2020, I'm just gonna go to 2030 again.
OFLCT.
And we'll go down
APEOT.
and down.
TZVEC.
So she's seeing 2020. And